So that
there is an internal mechanism. There is an internal mechanism for regulation and control the amount of blood flow around each alveolus. We consider this as an alveolus and this as an capillary. Okay? So, this mechanism is this. When the amount of oxygen is enough inside of the alveoli. For example, in normal conditions, the oxygen pressure should be 104 milliliter of mercury. And by this amount of oxygen, the amount of blood flow inside of the pulmonary capillary is good and is physiologic and is enough. But when the oxygen pressure decreases inside of the alveolus, step by step, you can see that the amount of blood flow inside of the capillary pulmonary decreases and decreases. So the amount of blood flow inside of pulmonary capillary depends on the amount of oxygen pressure inside of the alveolus. The less oxygen lead to less pulmonary capillary blood flow. In fact, we can see a specific phenomenon by the name of hypoxia-induced vasoconstriction. In this condition, we can see that when the oxygen pressure inside of the alveoli, this normal and physiological range for oxygen inside of the alveolus should be 104. This value and this point is very important. When this oxygen decreases and reaches to 73 milliliter of mercury, or reach to 70% of normal value, 70% of 104 milliliter of mercury is 73 milliliter of mercury, or decreases 6% from this. We can see that here we have not any blood flow. This phenomenon is named hypoxia. Hypoxia means that when the oxygen pressure reaches to 70% of normal value. Hypoxia induced vasoconstriction. Vasoconstriction means that the diameter of the vessel decreases and decreases. And this decrease leads to less and less blood flow. This phenomenon is named hypoxia-induced vasoconstriction. What happened? This blood flow deviates, shifts to other alveoli, that in this alveoli we have a normal oxygen. Or it's better to say that when we have a good expression, for this good expression, we should have a good blood flow for the good ventilated alveoli. So, but for this, we have three mechanisms. Tell that this hypoxia, or it's better to say that this decrease in oxygen content inside of the alveoli leads to more production of vasoconstrictor. You know that inside of the circulation we have two types of agents that affect the diameter of the vessel: vasoconstrictor and vasodilator. Tell that by this hypoxia, the amount of vasoconstrictor increases and increases. For example, indicators that in this situation, the concentration of endothelin Endothelin is a biochemical agent that has a vasoconstrictor effect. By this vasoconstrictor, the diameter decreases and the blood flow decreases. This is the first mechanism. The second mechanism, tell that the epithelial cells of the alveolus, the epithelial cell of the alveolus release the very low amount of vasodilator. You should know that in normal condition, we have large amount of vasodilator agent. For example, nitric oxide. Nitric oxide is produced large amount. But by this hypoxia, the amount and the concentration of this vasodilator decreases and decreases. This vasodilator when decreases, what happens? The diameter decreases and the blood flow decreases. This is the second. So the first, tell me that the amount of vasoconstriction increases. The second, tell that the vasodilator decreases, such as NO, such as endothelin. The third mechanism, tell this that inside of the muscle cells of the vessel, we have oxygen sensitive potassium ion channel. Means that when we have oxygen, this potassium channel is opened. When the potassium channel is open, potassium goes from inside of the cell toward the outer of the cell. When the amount of oxygen decreases, what happens on this potassium channel? This potassium channel closes. When oxygen is available, this potassium channel is open. By opening, we have going out of potassium. But when the oxygen pressure decreases and we have hypoxia, what happens? We have not enough oxygen. And this channel has not enough oxygen. And this channel closes. What happens by closes? We have not the diffusion of potassium from inside of the cell toward the outer of the cell. And we have a retention of potassium inside of the cell. By potassium retention, in fact, we have retention of positive charge. Because potassium is positive charge. What happened? By retention of positive charge inside of the cell, we have depolarization. By this depolarization, we can see that a specific calcium channel is activated. Which channel? Voltage dependent calcium channel or depolarization dependent calcium channel. This calcium channel opens. What happens? By opening of the calcium channel, calcium released from outside inward the inside of the cell. The calcium amount increases inside of the muscle cell. When the calcium concentration increases, what happens on the muscle cell? Contracts. By contraction of the smooth muscle cell, the diameter decreases. By decreasing diameter, the resistance increases. By resistance increasing, the blood flow decreases. And here we can see that we have hypoxia-induced vasoconstriction. In this part, you can see the systolic and diastolic pressure in arterial. Which artery? In arteries. Which arteries? Systemic arteries, such as aorta and bronchial artery. In bronchial artery, similar to aorta, the systolic pressure is 120 millimeter of mercury. The diastolic pressure is 80. But here indicates the systolic and diastolic pressure in pulmonary circulation. Which part of pulmonary circulation? In pulmonary artery. In pulmonary artery, you can see that the systolic pressure in maximum point is 25. Diastolic pressure is only 8. When I compare this pressure in pulmonary in pulmonary artery by bronchial artery, I can see that the bronchial circulation is high pressure, the pulmonary circulation is low pressure. Again, you can see here different vessel of the pulmonary circulation. At first, pulmonary artery. In pulmonary artery, systolic pressure is about 25. Diastolic pressure is 8. The mean arterial pressure is about 15 millimeter of mercury. In the second vessel, pulmonary capillary. In pulmonary capillary, pressure is about 7 millimeter of mercury. But in systemic capillary, the pressure is about 17. But here is 7 only. 10 millimeter is less than systemic. And at the end of this figure, you can see the pressure inside of the left atrium. The left atrium pressure is very important in pulmonary circulation. Can you tell me that what happens if we increase the left atrium pressure?
It will be more difficult for blood to flow from the lungs to the left atrium, so the blood will back up.
And accumulate inside of pulmonary circulation.
Cause edema.
And edema can lead to edema. So it's very important, the left atrial pressure. More left atrial pressure leads to more pressure inside of the B4 vessels. B4 vessels is the same pulmonary veins, capillary, pulmonary capillaries, and at the end, the pulmonary artery. In the pulmonary capillary, when the hydrostatic pressure increases, what happens? Maybe leads to pulmonary edema. So
it has to be increased more than 7 to become a problem?
in pulmonary capillary 7, in pulmonary capillary 7, but in systemic capillary pressure 17. When compared, I see that in pulmonary circulation, the pressure of capillary is less than systemic. And for this, we name pulmonary circulation as low pressure circulation and systemic pressure as high pressure circulation. Okay, so tell me that what happened here. In this figure, at first, I should tell this. When I talk about blood flow inside of the lung, it's important, the position of the person is important to us. In standing or sitting position, no lie down. In standing and sitting position, the lung has height. From top to bottom, you can see the height for the lung. This height is about 30 centimeters. Is 30 centimeters. So I divide these centimeters, these 30 centimeter height to 3 levels: bottom, middle, and top. So here in horizontal, you can see 3 levels: top of the lung, middle of the lung, bottom of the lung. Which lung in standing and sitting position? That lung has a height, 30 centimeter height. And in this 30 meters, in this height, we can see this top, middle, and bottom. In vertical, you can see the amount of blood flow. Tell me that, what happened on amount of blood flow? When we move from top of the lung toward the bottom, what happened? You can see that step by step the amount of the blood flow increases and increases. Means that in the top is less, in middle is more than the top, and at the bottom is more than the middle. Or when I move from top toward the bottom, the amount of blood flow increases and increases and increases. When we have exercise position, exercise situation. In exercise, you can see that the amount of blood flow for all level of the lung increases. For the top increases, for the middle increases, for the bottom increases. Again, you see the same line. This line has height. How much? 30 centimeter. 30 centimeter. You can see this 30 centimeter. 30 centimeter. Okay? So, when I go upward from bottom for 10 centimeter, or opposite to this, when from top I go downward 20 centimeter in this level. 10 from bottom or 20 from top. In this level, I can see that this level of the line is parallel with the heart. You can see this point parallel to heart. Okay? In this point, in this level, we have the pulmonary artery by systolic pressure about 25 millimeter of mercury and diastolic pressure 8 millimeter of mercury. Means that when I tell that the pulmonary artery pressure is 25 to 8, systolic 25, diastolic 8, means that the pulmonary artery lies or puts at the level of the heart. In this point, the systolic pressure is 25. In this point, the systolic diastolic pressure is 8. Means that you should know that when 1 centimeter we move from upward, 1 centimeter, or 1 centimeter we move downward. By this centimeter movement upward or downward, we can see that the pressure changes. How much? Pressure changes about 77 millimeter of mercury for each centimeter changes.
From the heart or what?
From the level of the heart. At the level of the heart, told that the systolic pressure is 25. The diastolic pressure is 8. But I want to calculate the systolic and diastolic pressure for pulmonary artery at the level of 1 centimeter upper than this point. Each centimeter can change 0.77 milliliter of mercury. But when we go downward, each centimeter increases pressure. When we go upward, each centimeter decreases 0.77 millimeter. By this, look at here please. I want to calculate the systolic and diastolic pressure in pulmonary artery at the top of the lung and at the bottom of the lung. Top of the lung. At first, I want to talk about the bottom to top. What is the distance between top and this level? From top this to level. 20 centimeter. 20 centimeter. Each centimeter decreases 0.77. So here this distance is 20 centimeters. So 20 multiplying by 0.77 is about 50. 20 centimeter is distance between the top and the level of the heart. For each centimeter, 0.77 millimeter of mercury, we have pressure changes. The distance between the top and the level of the heart is 20 centimeters. So 20 multiplied by 77 is about 15 millimeter of mercury. So 15 millimeter of mercury, the pressure at the top of the line should be less than heart level. So when I want to calculate the systolic pressure, I should decrease 15 millimeter of mercury from systolic, or at the top of the lung, of the heart, the systolic pressure is 25 and diastolic is 8. At the top, 20 centimeter is about 15 millimeter of mercury pressure. So we should increase 15 millimeter of mercury from systolic and 15 millimeter of mercury from diastolic. And at the top of the bottom, at the top of the line, you can see that the systolic pressure is about 10 and diastolic pressure is about -7. You can see here. At the bottom, what is the distance between bottom and the level of the heart? 10 centimeter. For each centimeter, how much? 0.77. 10 multiplied by 0.77 is about 8. 10 multiplied by 0.77 is 7.7, and when I want this is about 8. At the bottom, we should add 88 millimeter of mercury for systole and 8 for diastole. But by this, you can see that the systolic pressure at the bottom is 33, and at the diastolic pressure is not 8, is 16. Okay? So, is the first. The second, tell me that I want to have a blood pressure. Again, this is our alveolus, and this is the capillary. Here I want to have a circulation, blood circulation inside of this capillary. For this, we consider 2 types of pressure: inside pressure and outside pressure. Outside and inside. For pulmonary circulation, the inside pressure should be more than outside. Inside pressure should be more than outside. But because if outside pressure is more than inside, from outside can compress the vessel and can occlude, can block, and for this we have not blood flow. So the first condition is this: the internal pressure should be more than external pressure, or internal should be more than outward pressure. Okay? But we consider this: the outward pressure is the same alveolar pressure. The outward pressure is the same alveolar pressure. And alveolar pressure at the beginning of the inspiration or expiration is 0. So the outward pressure is 0. And we have no any word by this. The remaining parameters is internal pressure. Okay, so, but this internal pressure depends on the pressure inside of the arterial blood before this capillary in pulmonary arterial. Here we have systolic pressure and diastolic pressure. When during the systolic pressure, the pressure inside internal pressure is very high. During diastole, is very less. By this, we have 3 types of blood. 3 types of blood inside of the lung. Zone 1 blood type, Zone 2 blood type, Zone 3 blood type. At the end, at the last, I will talk about Zone 1. Because in physiology condition, we have not this type of zone inside of the lung. So, I want to talk about zone 2 and zone 3. Zone 2, you can see at the top of the lung, at the top of the lung. At the top of the lung, you can see zone 2. Zone 2, tell me that external or outward pressure is 0. Internal pressure during systole is 10. During diastole is -7. By this, you can say that at the top of the lung, during systole, we have blood flow. Why? Because internal pressure is 10, as this 10 is more than 0. So during systole, we have blood flow. Okay? What happened during diastole? During diastole, the pressure decreases to -7. -7 is less than 0. Means that during diastole, we have not blood flow. This type of blood flow is named zone 2. Means that during systole, we have blood flow. During diastole, we have not blood flow. In which part of the lung? Top of the lung. This type of zone is named zone 2. Opposite to this, we move to bottom of the lung. Bottom of the lung. During systole, the pressure is about 33. 33 is more than 0. During systole, we have blood flow. During diastole, blood flow. This type of blood flow is named zone 3. During both of systole and diastole, we have blood flow. This blood flow is continuous. This continues. And we have during both of systole and diastole, but in zone 2 only we have blood flow during systole, not diastole. And this type of blood flow is intermittent. Intermittent. During systole we have, during diastole we have not. By this, I want to talk about zone 1. Zone 1, then happen that the systolic pressure reduce less than 0. For example, during bleeding, hemorrhagia, the systolic pressure decreases and can decrease and reach to 0. And in this type of the blood flow, you can see that the systolic pressure in zone 2 decreases and decreases. And by this, you can see that during both of systole and diastole, we have not any blood flow. We have not any blood flow. So by this, we can briefly talk about these zones during systole and during diastole. In zone 1, during systole we have not. During diastole, not. Zone 2, during systole we have. During diastole, no. Zone 3, during systole, yes. During diastole, yes. Okay. These zones indicates that in which part of cardiac cycle we have blood flow inside of the pulmonary catheter. And the last subject is this, that we should know that in exercise only we have zone 3. In exercise, in sitting or standing position, we have not zone 2. Zone 2 is converted to zone 3. During exercise, only in the lung we have zone 3. And in lie down position. In lie down position, again, we have only zone 3. We have not zone 2. Because one part of the lung lies parallel with the heart. And both of systole and diastole pressure is more than 0. And for this, we say that in lie down position, in exercise, only in this situation, we have zone 3. We have not zone 2 and zone 1. So, in normal and physiological condition, we have zone 3, zone 2 at the top of the lung, zone 3 at the bottom of the lung. And during exercise and during lie down position, only we have zone 3 circulation. I think that is enough for this session. Okay. Inshallah, next session tomorrow, 8:30.